My name is Dr. Amouyal. I am an interventional radiologist and I perform endovascular and interventional oncology mini-invasive therapies. Interventional radiology is a medical specialty consisting in performing mini-invasive therapies without a scalpel through the skin, which is called percutaneous. Those interventions are performed by radiologists, therefore they are called interventional radiologists, and they can be divided in three main fields. First of all, the endovascular treatments, then the interventional oncologic treatments, and at last, the bone treatments. About endovascular treatments, it can be either embolization, which consists in occluding a vessel in order to treat some organ, or it can be angioplasty that consists in dilating an obstructed vessel in order to bring back some blood supply to the organ. About interventional oncology, physician can perform small samples of tumors, which is called biopsies. They can also treat small tumors that are located in lung, liver, kidneys, or even bones. They can also treat obstructed ducts like biliary ducts or even urinary ducts, and pain treatments. And also about bone treatments, it can consist in treating fractures, for instance, vertebral fractures using cement injection, or even articular repair using screws. Well, interventional radiology is evolving in every field. For instance, for endovascular treatments, patients can now benefit promising in mini-invasive treatments, for instance, for benign prostatic hyperplasia with no sexual disorder after the intervention. Also for uterine fibroids with no scar. Also for varicose veins, such as varicocele for male or pelvic vein congestion for female in order to treat chronic pelvic pain. Hemorrhoids can also be treated with chronic bleeding and no post-operative pain. And there is this very promising mini-invasive treatment for knee osteoarthritis in order to treat chronic pain. About oncological field, the use of 3D imaging is more and more frequent and permits more and more accurate treatments in this field. So I think it's safe to consider that for a physician to master interventional oncologic treatments, there is need for perfect skills in diagnosis imaging. And also for bone treatments, very recent treatments in chronic pain, mostly located in pelvic, use combined therapies with screws and also cement injections. Of course, there was some impact of COVID-19 in interventional radiology, like in every activity, I think. But there was no major impact in our treatments, as most of our treatments are performed during ambulatory care, and that interventions that were mostly cancelled were due to long hospital stays. So the fact that we perform treatments requiring short hospital stay makes us still treat a lot of patients. Of course, there are some safety precautions for our treatments. Every patient gets tested prior to the intervention, and they get to wear a mask during the intervention. I would like every patient to be aware that their condition could be treated without a scalpel in a mini-invasive way, possibly using interventional radiology. And I would recommend them to get information from their general practitioner or their relative to find out if there is a mini-invasive solution for their problem.